me now is Dr. Peter McCullough, cardiologist and epidemiologist. Dr. McCullough, and right on cue, yesterday the Biden administration renewed another COVID-19 public health emergency, this time for another 3 months. When will this end, and is this not fairly endemic at this point?
We're 3 years into this. It's clearly endemic. Remember, the death count is inflated substantially. About 90% of the deaths have other contributors. So it's really about 10% of whatever number is tossed out there dying solely of COVID. Very importantly, the emergency phase of the pandemic is over. The emergency is predicated on hospital capacity and hospital overruns. And we have no threat of that. We've actually made through 3 years without having hospital overruns. Clearly, all emergency measures should be dropped. All emergency countermeasures should be dropped, and we should return to normal.
Well, this is a full 2 years, right? We're on the third year. But MSNBC's Andrea Mitchell, Dr. McCullough, is practically begging Fauci for mask mandates to never end. And she had someone agreeing with her. Watch.
We understand that the TSA is going to extend that mask mandate for public transportation. Why only 15 days?
I think making a decision for April 18th, I would agree that we really do need more time.
Dr. McCullough, do you believe if these folks have their way, that we will ever be maskless on commercial aircraft again?
I think everyone should understand that at that point in time, the masks have no role and just become an encumbrance. So I think at this point in time, it's symbolism, and we should drop it. And the more we can return to normal, the best that is for the country.
Now, on the other hand, under Governor Glenn Youngkin, Virginia seems to have learned some basic immunology or relearned what they already knew. It's drafting endemic COVID guidelines, Dr. McCullough. And in just a few words, Virginia's new health commissioner, Colin Green, I think made a profound statement. He said, we're getting to the point where we're spending a lot of resources trying to prevent colds. Dr. McCullough, I love that line. It is a coronavirus, is it not? And as it mutates, at least this new subvariant, it seems less virulent and more transmissible, which is kind of what you learned in med school, correct?
True. Omicron, remember, Omicron is the most highly mutated form of the virus. It's the least virulent. But because there are so many mutations, there's an opportunity for subvariants. So BA1, the BA2 is which our majority one now. There's also XD, XE, and XF. These are all in the Omicron family. Patients get durable immunity once they have Omicron. And we now have papers, one from Luand and colleagues from University of California at Berkeley, less than 1% chance of ICU or death. Some of the randomized trials, and I've been looking at them carefully, on the vaccinations, many of the studies now report no hospitalizations whatsoever. It doesn't matter if what arm you're in, no hospitalizations.
So in other words, if you haven't been vaccinated and you, just like when you got Omicron, the first Omicron, if you get this Omicron subvariant, is it like a natural inoculation? I know I'm not probably saying that right, but is it like getting a protection because you are infected?
The European Health Agency said an Omicron infection of any type essentially works as a natural booster for an antecedent variant, whether that be wild type all the way through Delta. Once one has Omicron, there's not a meaningful chance of a second Omicron infection.
I guess a new Israeli study is being touted showing that seniors over the age of 60 or 65 get some benefit from a fourth shot. Would you agree with that, or do you take that with a grain of salt?
It doesn't look like it's worth it. There's two papers, one by Amit and colleagues, one by Bar-On, all dealing with fourth doses of either Pfizer or Moderna. The vaccine efficacy overall is way less than 50% for all groups, actually as low as 10% in some groups. And we don't know the cumulative toxicity now.
Dr. McCullough, it's always great to see you. Thank you so much.